Can't see me on the screen because I'm not in very good shape this morning.
I'm sorry to hear that, Don. I'm glad you could join on WebEx
Thank you.
or Zoom. I'm sorry. Okay, I'm going to call this meeting of the Health and Human Services and Veterans Standing Committee to order. We will start with the Pledge of Allegiance. Since Mr. Renish is in the room, I'm going to have him lead us in the Pledge of Allegiance.
I pledge allegiance to the States of America, to the republic for which it stands, one nation. Justice for all.
Thank you. Okay, and Angie, did we have proof of notification? All right. So then for approving agenda, I did want to say I'm going to probably move number 7, the review of committee purpose and committee structure tasks, nearer to the bottom so that we can get through some of the other business things first. So with that in mind, I would need somebody to make a motion to approve our 23-point agenda.
I'll make a motion.
Okay, thank you.
That's right.
All those in favor, please say aye.
Aye.
Any opposed? Okay, next is approval of the previous meeting minutes. Did anybody have any changes or corrections to those? If not, I need a motion to approve.
Approved.
Okay, Mr. Van Landijk, and a second? Okay, I have a motion and a second. All those in favor, please say aye.
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 Any opposed? Okay, that takes us to number 6, public comment. Is there anyone from the public, either here or in person or online, that wishes to comment? Okay, hearing none, we will move on. As I said, we're going to move number 7 later in the agenda, so we'll move to number 8, which is the 2022 VSO budget summary. It's not.
Good morning.
Good morning.
The 2022 budget summary is what you're,
That's what it says, but
2023? Okay.
yeah. it might
Yeah.
just- Well, have you already finalized the 2022, everything was in?
From last month?
Yeah.
Right.
Okay. All right, then I guess we need to change that to 2023.
Yes.
Yeah, we're used to, it takes us a few months in HHS to get there, but anyways.
Yes. The budget has been uploaded into the committee folder along with the monthly expenses. If anyone has any questions, but besides that, there have been no unusual withdrawals from the budget this month.
Okay. Does anyone on the committee have any questions for Ms. Knock before we move on? Okay. That takes us to your admin report then.
Yep. So for this month, last month we had our POW-MIA trophy set up at WCCU, and graciously, Community First Bank is now letting us establish and set up there for more outreach purposes. We've also decided that since the announcement of COVID officially coming to an end, federally recognized, we decided that we're going to pour a lot more into funeral homes and the nursing homes and community center. I spoke with the city administrator, and we're going to be making a bigger push come this spring. But besides that, everything in the office is running accordingly.
Thank you. Any questions from anyone?
Yes, what do you mean by a bigger push?
Since COVID is slowing, decreasing, we're going to be doing a bigger push for outreach.
And what are you defining as outreach?
Just basically what I said, the funeral homes, we have tables set up, monument companies, we have tables set up. We're going to be putting out more brochures and information into the public.
So will you be out of the office a lot?
No more than usual, I would say.
Well, what's usual?
It depends on how many home visits I have, I guess, or nursing home visits. It's not really an average. It changes daily, weekly.
Well, do you have on your report how many home visits you have?
No.
Well, that would be very helpful to the committee, I would think. Thank you, Madam Chair.
Number 10.
The fund originally started in 1977 by a man named Theodore Roosevelt Rue. I love his name. I just like saying it. He donated approximately $2,583 from his estate to go towards veterans to be utilized by the county. Resolution 77-30 in a resolution stated that the Veterans Service Commission would determine what to do with those funds. And mind you, this is 1977. So there have been a lot of CVSOs and committees and commissions that have come and gone without having utilized this to the extent that it should have been. So what we would like to do with the fund is, this is my request, is that the funds be utilized by Richland County departments as needed by veterans that might not have the funds for specific county fees. Cantina items, if they have transcripts that they need to pay for, if personal hygiene items, if there's any type of fees, filing fees. I spoke with the county clerk's office and they said for restraining order fees when they get served, most of the time they waive those. If it's for a restraining order, but sometimes there are fees and stuff that come from that. So depending on their situation, I've put everything into the committee folder for you to review. But that's the proposed policy that that we put together to utilize the fund and thus getting those funds out into the public for Richland County veterans and their dependents to use.
I gather you are suggesting that these funds would be available to any department who may have a veteran who may come to them with some particular need that applies here. Is that correct?
That's correct.
So you will have a proposal for the committee to review next time in writing?
It's in the committee folder.
Okay, policies and procedures, huh?
I gave a background information, and the original resolution is in there, along with the policy and procedure that would apply. The committee would just need to approve that.
Okay, so you're going to bring forth a proposed policy and procedure for approval by our committee.
It's in the folder. What? I'm sorry, Ingrid, what'd you say? I didn't hear you.
Ingrid, I can't hear you. Is your mic on?
Okay. Now can we hear me?
Yes, sorry.
Okay, I apologize for that. Don, or Mr. Seep, the policy is already in our folder, so the plan would be for us to take action on that today. So
when was it put in the folder?
It was uploaded yesterday, more than 24 hours prior.
Can I that we? I'm sorry. Can I ask that we bring this to the next meeting? Is that possible so that we have more time to review?
Sure, that would be fine. I did want to ask you a couple questions. So all of the funds that he had originally donated are still, like, they had not been utilized?
They had been utilized a couple times throughout the years, and then more was donated back into that fund.
Oh,
And
from other sources?
yes.
Okay. So is it still currently at the like 2,000?
2,420. It's on my summary page, the 24. That was
Oh, is that the total?
Is that an element under the Soldiers and Sailors Relief Fund?
no.
Well, it was last time it was reported.
So we're looking at 10 Fund 84 activity, I believe, correct, Mr. Langrick? Is that where you're finding the total? Okay.
The finance officer said 24, so I will make sure to confirm prior to next meeting.
Okay, and maybe it states in the policy, but then is it still residing in, what did we say, the county clerk had that fund? So if somebody wanted to apply to utilize this, it would go through county clerk?
So what would happen would be the department would hand out a short application with a letter of understanding, and then they would come to me whether to be approved or not. And then at our monthly meeting is when I would report where those funds were distributed.
Okay. All right, thank you. Are there other questions? Yes, Mr. Van
One
Dyke.
other thing, this has been on for quite a while, and I want to say that I'm appreciative of the fact that it's finally going to be utilized for a good purpose. So thank you.
Yes, I appreciate you putting together this
I have a
policy.
question, Madam Chair. So if there's any future donations come to the office, is there multiple accounts they can go to, or is pretty much all donations go to this fund, the RU fund?
So typically when people contact my office because they want to donate, I direct them to the American Legion because it has a needy veterans fund that our office can help the veteran apply to. Chapter 7 has a fund. The state of Wisconsin VFW has a fund. So that we don't have control over those funds, but outside sources do.
But if they insist, it would end up in this account?
That's not necessarily true. We don't really encourage a lot of donations to county government.
The donations to do, the name of the actual fund is a Veterans Donation Account. It's set up as account or fund balance or fund 84. 84, thank you.
Mr.
yes,
Langrick?
Can you not hear me?
Yeah, I can hear you.
Mr. Langrick, please.
Can you hear me now? So
Yeah.
it's set up as Fund 84, and it's your Veterans Donation Account. Now, I think it originated with the Teddy Rue donation, to the best of my knowledge. As
Yeah.
CDSO Knockett said, we haven't tracked if that original $2,000 some dollars has ever flowed out. You know, those dollars actually exited. It's been kind of used as a veterans in and veterans out fund, to the best of our knowledge, since its origination. Does that answer the question?
Right.
Yeah.
I understand the history's probably skewed, and that's fine, but that's why we're here having this conversation. So my question is, just going forward, is this going to be the fund that if somebody does want to donate, would they go into this fund? So could possibly the amount continue to grow? Even though Karen gives it away, can money still be put back in?
It can. Right now, this policy calls for, at the end of it, it says this policy in Fund 84 shall dissolve upon depletion of all available funds. If there's future funds that are coming in, you can reactivate it, reopen it, put it in a Fund 10 where it would lapse, what you folks want to do. The intent of trying to dissolve it, though, is to put a rest and say that, you know, on behalf of Teddy and his generous contribution, that we've completed that task and we've redispersed those funds. But there's multiple ways to handle it. Does that answer your question, Supervisor Reynolds?
Correct. So it has a sunset, and then from then on, would want to encourage them to give somewhere else. So we don't-
I direct to like I said, to local.
Just a minute, Mr. Seep.
I usually direct money to Richard Carnes, who handles the American Legion funds. Gail Surham, the 48, I send that because I know that money will be available for our office with proper procedure if they need it. So to not keep the funds in-house, but to give out where other veterans, not just the ones that are in my office, may benefit from it.
Yes, Mr. Steep. And then
Yes,
Mr. Van
Madam
Landen.
Chair. One, Mr. Langrick, I'm sure that you will agree that there is nothing to discourage, no reason to discourage people from donating, making a cash donation to the county, to the veterans, to the Veteran Service Office. Am I correct? Why would we want to discourage people from donating money to veterans as they have in the past? And why would we want to subsidize other nonprofit organizations?
So some of the
We have a
questions that I
mission
would,
to aid the needy in our own county mission.
Okay, Mr. Steep. Mr. Langreck, I'm sorry, you had something you wanted to say to that?
in general terms, some of the concerns that you have to encounter, and this is on a case by case, is if there's defined purposes that somebody wants to donate it for. If it's matching existing policy, then that's okay. The other element that typically comes into place in discussion with Karen is the speed in which we can release funds. It's a challenge for us to try to do immediate needs because in order to release funds like out of here, it's going to require an application process, a review process, and then it's going to have to still go through our office to process it and release potential check and funds. And as this policy is written, we're trying to avoid a direct release to the veteran. It's going to be to a vendor or some type of utility on their behalf. Those things take time. Nonprofit agencies and entities potentially have less restrictions to be able to get funds in the hands of folks in a more timely fashion. Those are some of the reasons on why you may want to promote it. But again, it's up to you folks on what you want to do with this fund. If you want to keep it in place, post Teddy Rue and make changes, you certainly can. I would, while I've got the mic here, encourage you folks too to probably cue in on page 2 of 8 of the document. It's talking about what's your qualifications of needy and what it's anticipated that the funds can be used for. In the other part of the application, I think that would also warrant a good look at is on page 3 of 8 or underneath section 9, where it talks about on the authority that you would want to bestow on the CVSO to grant authorities to be able to bless off on funds. And again, that's with the intent of trying to get funds into folks' hands sooner than later, rather than having the necessity of having the commission meet to take action on it. Thank you, Madam Chair.
Thank you, Mr. Langreck. Okay, so I guess I would ask the committee to please review this. We'll keep this on the agenda for next meeting, and then we'll make a motion at that time.
Madam Chair, just
Yes.
one more comment. I just want to make sure that the committee is aware that we have a separate needy veterans fund that is specific to the county.
Okay.
So these funds, once they are depleted, there is still money within our county for emergencies.
Okay.
This fund had a task, it had a purpose. And so all we're asking to do is to meet that task as was expected 46 years ago. And then we do have existing funds within the county that are paid by taxpayers every year.
Okay, thank you. All right, so that takes us to number 11, the VSO future budget response. I didn't see anything in I guess I'm not exactly sure what this is referencing.
I actually spoke with Administrator Langrick yesterday, and we're not sure either. But it is put on the agenda for both
I feel
department
like I
heads.
did see that. Maybe Auntie, maybe you could speak to it and remind us.
After the end of last meeting.
Uh-huh.
On this one. So it's also. I'm not sure what that I have no idea what.
Is Tim online?
I don't think he's online. And I apologize. I should have followed up more on that. I think that just, yeah.
Do you want to
I
move?
find- So.
Do you want to move that till next month too?
Yes.
Okay, we
I
can do
can try
that.
to contact him and see exactly what he was looking for. I apologize for not following up more clearly on that. Okay, so I think that concludes that portion of it.
Thank you, Madam
Ms.
Chair.
Knott. All right, so we'll move on to our consent items. Number 12, the HHS expenditure report. Again, these are consent items, so I don't know if there's anything notable that anybody wanted to mention in that or have questions. Otherwise, we'll keep moving. Budget summary, do we have? Let me pull it up. Is this the end then of 2022?
No. No.
Okay,
Yeah, this is Stephanie, by the way, speaking. I
thank
don't
you.
know.
There you are. Hi, Stephanie.
Yeah. I'm here. I'm online today. Yeah, no, we still have, if you look back on the vouchers, we still had some 2022 expenses that we were still paying. And I know, some of the programs in our behavioral health clinic with the way we bill and invoice, we just submitted our billing for December last week. So yeah, so we still have some things that'll be moving around in the budget for 2022.
Okay, so then I would kind of like to get like when it's the finalized one, maybe have you go
Sure.
over it. So maybe next
Yep.
month is kind of the hope then.
Hopefully, fingers
Okay.
crossed. I know we've been given some direction that they want to close the books mid-March.
Okay.
So hopefully we'll have everything in so they can do that. And if we have everything in, then yeah, then I can say it's probably final then at that point, especially once the auditors tell us it's done. So.
Okay, thank you, Stephanie.
Yep.
And then contract monitoring report, I didn't see anything that looked like it was highlighted, so.
No.
There it is.
Okay, so yeah, if Steph has more things that are coming through, then I can redo this again, but most of the invoices I saw were through December. So you never know what might trickle in, that they have a final invoice, one more throw at it, but there was a couple that were still November I was still looking for. And some of them are bigger ticket contracts. So I will look at it one more time for 2022 and put that out there. And then I'll just write final on it. But otherwise, 100% utilization was what we were looking for, and a lot of them are well under that. So we should be good.
Okay, so that takes us to approve HHS contracts, agreements, and amendments.
Yes, we have two. Both are for children with disabilities, or our children's long-term support programming, both for 2023. So the Gymboree is that recreation alternative activities. That is formerly known as Gap Fit and Fun here in town. So they've been renamed and purchased by another local family. So it's the Richland Center location. United Seating and Mobility is specialized medical and therapeutic supplies. Both of them are looking for $11,000 max, or up to.
Okay, I know we've used Gap in the past, but the other one, is that new for us?
Yeah. We do a lot of seating mobility. We have another one, I think it's called National Seating Mobility. So it's, I'm sure, just a competitor, and it's based on family or client need and request.
And we'll need to take action to approve this, correct?
Yes, please.
So I would take a motion to approve these two contracts.
So moved.
Mr. Van Landijk? Do I have a
Second.
Thank you, Ms. Rudersdorf. All right, all those in favor, please say aye.
Aye.
Opposed? Apologize, I should have asked if there was discussion. Any questions or anything about that? Okay, that takes us to number 16, approve the application and acceptance of treatment alternatives and diversion, or TAG grant.
So this is a grant that we apply for on a yearly basis. We're asking just that the committee approve our acceptance of the grant. I will let you know that this was done last year, and I apologize I didn't bring it to you timely, so that was an error on my part. I did ask Brandy Christensen, who is the treatment court coordinator, to come and talk a little bit about the program, just to provide additional information to the committee.
Great, and I don't think we've met you since the job
There you go.
changed, so welcome.
Thank you. I'm Brandy Christensen. I'm the treatment court coordinator. Is this on?
Yes.
Okay. I started in November, so coming in up on 3 months, I think. So treatment court has been in the county since 2017. It's really just a big collaboration of county and local agencies. We have our circuit court, the judge presides over it. In the district attorney's office, we have Jennifer Harper and Andrea Fields, a representative from the public defender's office, the Department of Corrections, the sheriff's department, the police department, and then some of our treatment providers in the community. We sit on a team. We meet right before court every couple weeks and staff the program and the participants. But it's just not the team that treatment court collaborates with. We talk with Trisha and Teresa at HHS to make sure we're following grant guidelines. The jail, they provide all of our, they do all of our urine samples on participants. Other law enforcement agencies, we work closely with the Department of Justice and the state problem-solving courts for guidance when we can't figure out a problem or issue on our own. And then a lot of the other treatment courts are a very intimate community because there's only like one coordinator in every county. So we all work really closely together to bounce ideas back and stuff. Currently, our courts can have 15 participants divided between the two. We have an OWI court and a drug court that recently started last year. Currently, right now, we have 3 in drug court and 3 in OWI court. We serve Richland County residents ages 17 and older. They have to be high risk, high needs with a moderate to severe substance abuse diagnosis, and they can't be a violent offender. That would disqualify them. And there was a Court of Appeals decision that was just passed last week that for OWI courts, we can't take anybody 5 and above. So we're serving OWI 3 and OWI 4 convictions right now. And just kind of the goal of treatment court is to reduce recidivism. Since 2017 with OWI courts, there's not been one person that's graduated the program that has received a new DUI. So we have a 0% recidivism for that. Our drug court is still too new to have really any statistics on recidivism. Another goal is reducing the jail population and even the prison population. When we put people in treatment court, jail's kind of our last result as a sanction. We try to provide those treatment and therapeutic opportunities before we result to jail. And then just offer programming instead of incarceration. Every participant has an assessment. They start at whatever level of care, residential, intensive treatment, and step down. And they have to work with their treatment provider throughout the program, regardless of how long they've been sober or how well they're doing. They still have to meet with them regularly. And then they also have to attend treatment court groups every week to talk about relapse prevention planning and things like that. I think that's a summary.
Does anybody have any questions?
Yeah, I have a question. I think it's a great program. I know people have been through it. The cash match of 27,000, I'm assuming that's billed to the participants?
It is not. That is.
Where does that come from?
That is county levy, and we have that approved through our 2023 budget.
Well, then you have a county match of
I'm
16,000.
sorry.
Yeah,
Oh, okay. The 23 or the
27.
27, what that is for through in-kind. So the time that Brandy uses to staff with her supervisor and myself, so my salary would then be used to offset this grant. The time that Andrea Fields from the district attorney's office or jail staff, that time can be used to offset this grant. So
in reality, it's still coming from the county budget. You're just bringing it from a different piece of the pie.
Yes.
Okay.
Yes. And it's for people who would get paid anyway by the county. And so it's just, yeah. Okay.
But for my thinking, it's still coming from the county budget.
Correct. Yes.
That was a great summary. Thank you. I just had a couple of questions so that I could understand. You mentioned OWI 3 and 4. Does that just mean how many times they've had an OWI?
Yeah, how many convictions?
Okay. And then is there a specific length for treatment, or does that depend on the person and the offense?
If someone does incredible in the program, no violations, they do everything that they're supposed to do, the minimum time is 14 months.
Okay.
So anywhere, it's 14 months to typically 2 years, depending on how well they're doing or if they have any setbacks.
Do you know for the drug treatment court in counties that have been using it, what their rates of like recidivism are so far? You've heard any statistics yet?
Not off the top of my head, no.
Okay. Yeah, that's just pretty cool. You said since we started, we've had a 0%?
Yep.
Do you know how many total we've had? Maybe it said it somewhere.
I think there's been around 23 people that have graduated OWI court.
Wow, that's pretty cool.
Mhm.
Other question, I don't know if which one of you would answer this. I thought, no, I may be remembering incorrectly, but I thought when we had applied for a grant, there was like a certain time frame.
We are granted for a 5-year time period. So currently it goes through, I believe, the end of 2024.
Okay.
So the state has said, yep, you're allowed to get it every 5 years or every year for the next 5 years, but we still have to turn in a grant application, show that the funding sources, show what our goals are. And that's something that Brandy really worked hard on when she came, is really getting those goals to be in compliance with state recommendations.
And Clint, do you know, was that still included on our 2024, like in that 5-year plan?
So
because I know that there had been some question with treatment court.
there was, but this is one that through the referendum ad hoc committee felt that it would be able to be saved.
Okay,
Yes.
even through.
Even,
Okay.
yes, yes.
All right, thank you for that answer. All right, any other questions? Yes,
Yes.
Mr. Van Lindijk.
What would the average age of participants be?
I would say right now in our program, the youngest one would probably be like 29, 30-ish. And our oldest one would say, I think he's in his 50s. So
Okay. I thought maybe younger ones might be, part of this, but
I
it
can
seems like
for-
the older generations are, okay.
with our drug courts, I can foresee getting younger populations. But hopefully if someone got OWI 5, it would happen, 2021. So OWI is typically a little bit older, but I think with our drug court, we'll start to see younger populations.
All right.
Madam Chair, I would make a motion to apply for the grant or adopt the resolution.
Yeah. We do
Yes.
need that.
Okay,
Yes.
so we have a motion. Do I have a
I
second?
second. This is
Thank you, Ms.
Cindy.
Picker. Any more discussion? Not all those in favor, please say aye.
Aye.
Any opposed? Okay, motion carries. And thank you very much for your report. Okay, that takes us to number 17, Richland County opioid needs assessment presentation.
So I would ask Misty to come and speak. She is with the Southwestern Wisconsin Regional Planning Commission. Just as a little background here, there was a opioid settlement, and the county is in receipt of funds to help for prevention, treatment, and rehabilitation for those who suffer with opioid disorders. And so we had hired Southwestern Wisconsin Regional Planning Commission to complete a needs assessment for Richland County. And Misty is here to give us information on what she found.
Thank you for that great introduction, Tricia. Appreciate it. So yeah, I'm Misty. I'm the local government services specialist with Southwestern Wisconsin Regional Planning Commission. My background is about 20 years in local government, from a utility clerk to a clerk treasurer to a city administrator. And now I get to help a whole lot of communities. So I don't just get to help one, I get to help a whole lot. So it's a pretty exciting adventure for me. This was my first task with regional planning. So I was pretty excited to kind of get involved and see what's going on in the region and how we could help partner with you, because that's actually what we are. So not sure, I'll give you a little background on our company. Southwestern Wisconsin Regional Planning Commission is a local government, a branch of local government. We're governed by state statutes. We're actually your partner through this 5-county region, through Richland, Grant, Lafayette, Greene, and Iowa counties. And so we're here to help make it better. We're here to help put plans together to give direction to county boards, municipal boards, township boards, whatever that looks like, help write grants, help figure out where funds can come from. And so again, I just want to reiterate that we're your partner. So we're not just a company that's coming in to try to sell you a service. We're here for the county, and we're happy to do that. So we'll go ahead and I'll just start. with the presentation. If anybody has any questions, stop me along the way. I like to talk a lot. So the opportunities for the funds are prevention, treatment, and recovery of opioid use disorder. Next slide. So through our data evaluation and our research, we did come up with 3 priority recommendations. All 3 of these recommendations could be regional efforts as well. Support transportation options. So transportation for individuals in treatment and recovery phases to get to treatment or medical appointments, back and forth to work, meetings, or even taking their kids back and forth to school. So I think that is probably something you all hear, is transportation is an issue in our region. So not only in Richland County, but in the 5-county region. Removing or reducing barriers by defining eligibility, ensuring that all populations are reached and that can get treatment. It was evident that people who are being reached are not necessarily the ones who want help, but rather are in a position where they're required to get help. Thankfully, you have the treatment court. And so that provides accountability through that agency and through probation and parole. However, there's a population of people that want help, but maybe haven't gotten in trouble yet. So that's kind of a population that needs to be reached, and there has to be resources available to those people. The opportunity is a small window of time, and opioid use can happen to anyone. Iowa County put out a great Roads to Recovery video. It's on YouTube. So it's a great video to search. Talks about a school custodian who injured his back, got addicted to opioids, and just went on a downhill slide. It took one time. So that's reducing stigma around opioids and realizing that it's not just certain people that get involved in drugs, but it's everybody. So improving coordination. I know that there's been some new staff, and that's not just in Richland County, that's regional too. We're seeing this kind of influx of new staff coming in, and so new staff maybe aren't always aware of programs that have been in place and don't know how to communicate to people for looking for programs. So certainly improving coordination within the county and within the region and bringing regional awareness would be all good measures for these funds. Fine, thank you. Litigation settlement awarded since November of 2022 or prior to November of 2022 was $489,794 for Richland County. That amount has since increased, and you'll see it continue to increase as pending litigation gets settled. I understand there was another settlement in December, but those fund amounts have not been released yet. So there may be an opportunity for county officials to securitize a portion of the settlement funds. I'm not sure if this has been talked about at this board or at the county board, but it is something that your corp counsel will need to look into, because I understand that they're not certain that it's a qualified expenditure of use of the funds to securitize them. It is important to note that this is a one-time funding source, so it's not that you're going to get $60,000 every year forever. You're going to get these amounts, and then as pending litigation gets settled, but once it's done, it will be done. So adding a position and paying for a position forever might not be a good use of funds. So our process began with research and data analysis. We found amounts awarded, eligible uses of the funds, and best practices through the state and country. By doing that, we found 7 good questions to ask. Actually, I found like 20 and really had to narrow them down. So we did ask 7 open-ended questions pertaining to what is being done, what can be done, and what should be done. We interviewed 14 representatives in Richland County virtually or over the phone. The stakeholders were identified with a meeting that I and Tricia had early on. And they included law enforcement, county agencies involved, school representatives, and medical professionals. In addition, we interviewed 8 regional stakeholders, and those included representatives from Southwest CAP, Unified Community Services, Wisconsin Department of Health Services, and UW-Platteville. These results are found in this broad scope needs assessment that identifies the county needs, a preliminary list of existing resources, and investment recommendations. In addition to the Richland County needs assessment, we have prepared a regional needs assessment for the 5-county region of Grant, Green, Iowa, Lafayette, and Richland. And that's currently under the review phase at Southwest CAB. There were 92 stakeholders interviewed for that regional assessment throughout the region. So that would be a good piece of information when determining where your funds should be spent. At some point, a more in-depth assessment may be necessary to identify medium and long-range plans as well, and we'd be happy to help out with that. Next slide. Page 6 to 8 of the opioid needs assessment. I think you all received a copy of the opioid needs assessment. I do have a couple paper copies here if anybody wants one today. Current resources in the county include Richland County Partners for Prevention. It's amazing. That's amazing that Richland County has that. That's a very valuable resource that not all counties have. And so they are very active, and their information was very easy to find what they're doing, how active they are. So that was great. Prevention, stigma reduction efforts, and educational outreach. They do a lot of work in the schools through DARE and Counteract programs. They have the Youth Substance Use Coalition, Drug-Free Communities Project, Safe Community Events, and then they also manage the prescription drug safekeeping and the disposal boxes. Southwest CAP does in-home visits through childhood programs, which gives them an opportunity to go into homes and find out if there is drug use. They can notify county agencies to let them know that, hey, there's something going on here. We need to get that checked out. Others were the Simon Center and healthcare. The Simon's Rec Center provides opportunities for residents to establish healthy habits and lifestyles, which help aid in the prevention of drug use and abuse. So that's an amazing resource that Richland County has as well. And the healthcare industry has education and training for prescribers and prescription drug tracking through ePDMP. So not only do the hospitals have to track what they're prescribing, but the pharmacists have to track what's being prescribed and if they're picking it up at other pharmacies and stuff to make sure that there's not that abuse and misuse. 86% of the respondents, so 12 out of 14 in Richland County, stated that prevention efforts are key in getting ahead of the epidemic. Prevention activities cited were coordination of existing resources as well as communication as to what is available and to whom it's available to, stigma reduction efforts, and more education, including parent education and awareness, and finding ways to get more positive role models involved, something like a Big Brother, Big Sister program. You see those in the bigger cities. You just don't see them out here in these rural areas. Others mentioned include peer support for youth affected, as well as increasing the capacity or bolstering existing services. In addition to the priority recommendations, transportation, coordination, and reducing barriers, additional prevention recommendations can be found on page 8 of the needs assessment, supporting and bolstering Richland County Partners for Prevention and the prevention efforts currently in place, especially in the schools, adding resources for youth mentorship, like the Big Brother, Big Sister programs, respite options. That was a need cited by a lot of the medical professionals I talked to, was respite options. People need someplace to take their kids when they're in an emergency or in a crisis situation, and they just can't handle day-to-day activities. It comes down to mental health, but they just need options available. Simon's Rec Center, that I keep thinking that that's a great opportunity if there were programs in place, and I'm not exactly sure what all programs are there, but just a great opportunity for Richland County residents. Pages 9 through 12 of the needs assessment, treatment, current resources are found. Medication assisted therapy, or MAT, provided by Health and Human Services and in the county jail for those incarcerated. Other services provided by County Health and Human Services include behavioral health services, economic support, Narcan Direct, and fentanyl test distribution. And that's probably not all of them, Tricia. I'm sure there's a lot more, so you can speak to that. Other treatment resources include the resources like the Simon's Rec Center, where people can change their negative addiction into a positive one through swimming or exercise, as well as change their social circles, helping to remove them from a life of addiction. Drug treatment court is highly beneficial for those in mandated treatment. It gives them that time to be held accountable. So not only do they have, do I want to go back to this life, or do I want to just give into this one if I just do it one time, but they have, oh, I might have to take a test on Monday. So, I should stay clean. There are peer support groups in the county, and Pine Counseling offer services for treatment. So again, needs that came up in the treatment category include coordination and information sharing and communication. So during the interview process, it really became clear that there are quite a few great things going on in Richland County. However, information was not easily found. Contact information was not correct or updated, and not all populations are being reached. Even when I was looking through just Google, I had to really dig to find information that I was looking for. And when somebody's in that crisis mode, it has to be at their fingertips. So finding a way to have it at your fingertips would be great. Stigma reduction was stated as a need, as well as a barrier to treatment. So any stigma reduction efforts that you could put into place would be beneficial. And then again, transportation. People in treatment programs or active in treatment court often don't have a driver's license or access to a vehicle, and therefore they struggle to make to their appointments, to their court appearances, to a job. So while treatment is lacking in many facets in the region, there is definitely a population that is not being served. And perhaps through a collaborative approach, that goal could be accomplished. Inpatient treatment, sober housing, treatment for those who want it is all lacking in the region, in the county and in the region. There's just not facilities, and who funds those facilities. You mentioned earlier who funds part of the treatment court. It all comes down to, where do you draw that line and who can you help? So additional options for peer support, reducing barriers, affordable and transitional housing, that's another thing that comes up all the time. We all need more housing. Next slide. Additional treatment recommendations can be found on page 12, and they include supporting and bolster the existing services. And I've listed those again, and then the additional needs, the detox beds, inpatient treatment, sober housing, transitional housing, and then making sure that your resources are bilingual. So that's a population that has to be reached as well. And then life skills training. Kids in school don't get to learn how to cook anymore. When I was in school, we learned how to sew, how to cook. A lot of those programs have been cut from the schools. And where do they learn it from? Especially if the home life maybe isn't what we grew up with. And so really just kind of reaching out and knowing that there's life skills training available, or even how to do child rearing. And finally, recovery. So some of the recovery resources, which are very limited in the area, is the LIFT program through Southwest Cap. They have a Work in Wheels car loans program. So if somebody who's trying to get a vehicle to go to work, they do loans for people who qualify, and they have some parenting training. Again, you have the Simons Rec Center that is health and fitness facilities and classes. It's a safe environment, and it provides a great place for safe socialization. In the recovery, identified needs were coordination of existing resources, stigma reduction efforts, transportation, increasing mental health capacity, peer support capacity, resources for life skills, education and guidance, housing options. And then additional recovery recommendations are found on page 14 of the assessment. And again, it's housing, mental health capacity, life skills, education and guidance, and respite for those emergent times when somebody just needs a break or just a little help. And then, so the blue are the measures that would fall under the prevention category. Orange are the measures that fall under the treatment category, and the green are the recovery measures. So you can see if you pool resources and you put it into coordination, transportation, stigma reduction, educational curriculum, you kind of get that broad range from prevention all the way through the recovery stages. Where if you just do parent education and awareness, you're getting prevention, not a bad thing. I mean, you have to get ahead of it at some point. So just kind of shows you, where to pool your money to get the most bang for your buck. So I did want to bring out, there was one statistic in there. According to the Surgeon General, for every $1 spent on substance use disorder treatment, $4 in healthcare costs and $7 in criminal justice costs are saved. That's $11 in savings for every $1 spent. And so if you look at who's paying for the criminal justice cost and who's paying for the healthcare cost, a lot of that is your county resources. So if you can spend $1 in the substance use disorder treatment, part of it, you can save that in your other agencies. And Richland County is no different than all the other counties. They're all in crisis mode. Our jails are overloaded. Our county employees are taxed and trying to do more with less. And so just knowing that what is our priority and how do we get ahead of this is key. And then finally, to reiterate, priority recommendations are improving transportation, removing or reducing barriers, and improving coordination.
Great. Thank you, Misty. That was really informative. Committee, does anybody have any questions? Yes.
Thank you for this report. I'm going to be running for Richland County School Board. And in that, what I'd like to know is how do you provide information or units or whatever to the local schools? I mean, how does that represent itself in the classroom, or does that make sense?
I think so. Yeah. So I did reach out to the schools in Richland County and did talk to someone from administration to find out what programs are in place. Richland County is way ahead of the other 4 counties in the region. I can tell you that. So, and they have a really good partnership with the Partners for Prevention with Betty Raisler. So that's an amazing program that's in the schools and really focused. Our organization does work with some school districts, but we mostly work with county and local government, but we are starting to reach out to the school districts. I did review their school community needs assessments during this process as well. So there is drug use in the schools.
Oh, yes.
You know, and so
That's universal.
again, I think Richland County has a good handle on that. Some of it is the lack of law enforcement. From what I understand in my conversations with people is there's just limited law enforcement agencies in Richland County. It's a smaller county. So you only have, is it one other full-time law enforcement agency, and that's Richland Center and Richland County, and they're both in the same community. So your county officers are sprung out over the county, and they're just not as available. And I think they're short-staffed too, from what I understand.
That could very well be. I taught at Washington Park High School in Racine. And there we had a full-time officer assigned to the building at all times that went around the outside of the building, talked to kids and, went through the halls and things. And it helped a lot because there was a presence there. What materials do you provide? Do you have any pamphlets, brochures, programs?
So I can provide any materials through my research that you would like. Mostly if Trisha's looking for something, or the county's looking for something, we'd be happy to dig in and provide whatever that may be. But that was part of the needs assessment is coming up with a list of resources available in Richland County. The back of the actual needs assessment it does have, the back couple of pages do have a pretty comprehensive list of what's in Richland County.
Okay. Do you provide any of that to the local school district, the superintendent, or any of the others?
So our contract is with Richland County.
Yeah.
And so we will.
Okay.
If Richland County wants us to do that.
Okay.
And I think that would be, or you would do that. So you could share that with the schools. And Betsy is a part of this group, so I'm sure that she probably has a copy of it and has shared it with the schools.
If that were to be done, would that be done through this committee? Or is there another committee that would deal with that?
I believe it's this committee.
Okay, thank you.
Yes, yes.
Yeah, and speaking of Betsy, not to put you on the spot, Ms. Raisler, but I see you're on the line. Is there anything you'd like to add or any comments to make?
No, I don't have anything to really add. I appreciate the assessment of the county there. I think the main thing is we need to work together. We need to not be in our own corner, but we need to maximize partnerships. And so I think from our coalition standpoint, it would be great to have, in terms of prevention specifically, those things that she mentioned in terms of stigma, life skills, awareness about medication safety, school programming. We need to develop a good partnership, some sort of memorandum of understanding that we would work together. And Cindy may want to add to this. She served as our chair the past year. But it still is on our coalition, on our data work group. We're constantly looking at the data. If you think about the kids, 6% in 2021 had reported they misused a medication that was not prescribed to them. So that's of 400 kids, that's still too many that are getting a hold of medications that could lead to a heroin addiction, potentially fentanyl use. So it's a big concern.
I think what has been, or what we have noted as maybe a gap, and it's mostly a gap in communication and coordination. The right hand doesn't necessarily know what the left hand is doing, or even that which hand has the resources when it comes to things like Narcan, fentanyl use, what we know often, at least what Partners for Prevention, which is basically working at prevention, especially at the youth and adolescent phase of introduction to alcohol use and any other substance abuse, such as fentanyl and even tobacco, has just been really finding the pockets of resources and what is going on so that we can, rather than duplicate efforts, multiply the effort.
And just one more thing, just to make you aware that while we do receive a federal funding to work on prescription drug misuse, our coalition has also been awarded with a large grant to work on this project as well. So we can combine our funds and conquer.
Thank you. I think on my end, I just wanted to clarify my question with the funds secure versus non-secure, and Mr. Langberg just left. But it says in here that Richland County has expressed tentative interest. What's the process with that then?
So what my understanding is they are trying to determine, the Attorney General's office is trying to determine, can these funds be securitized?
Oh, so we don't even know.
We don't even
Okay.
know if we can. So once we get the okay that they can, then I think it takes it to the full county board to determine which way we go.
Okay. And so for today, then I see under the recommendation, you're wanting us to approve creating a committee comprised of employees from HHS, Sheriff's Office, District Attorney's Office, Richland Center Police Department, and the Richland County Judge to take the recommendation of the opioids need assessment and create a proposal to the full county board on how the funds should be best utilized to support the residents of Richland County.
Yes.
Now, forming that committee, does that in itself have to go through the county board, or do we just do that here?
I think we can just do that here.
Okay.
I think. We can ask Clint when he comes back, but my discussions with him, that was my understanding.
Okay, and then how do we determine, does each department that's listed here just decide who's gonna join?
That's my
committee?
thought. Yeah,
Okay.
whoever they feel would be best to be at the table to have those discussions. And if there's other thoughts on who else should be at the table, I would be open to that.
Okay.
These are funds to serve Richland County residents, not just the HHS residents or clientele. So we really want to make sure that we are bringing everybody to the table.
And if I may interject, Madam Chair.
Yes, Ms. Chicker.
I would really encourage the members of that committee to be encouraged to think more globally, tend the heartstrings of people in the community tend to go towards treatment. But in reality, future success means hitting it at the prevention stage.
One other clarification question as well. On the year of distribution, when you look at the funds, I think this is on page 16 in that document. It lists in 2022 an amount. Does that get back paid then? I was a little confused by that.
It's my understanding that it will. Some counties have received that. I don't believe that we have received anything. That's something that I haven't been able to fully dig into yet.
Okay. Do you know, Mr. Langrick?
I don't have more of an answer than that at this
Okay.
time.
All right. And then we were kind of discussing, just as you were coming back in, with this action to recommend a committee forming, do you know, does that need to go on to county board, or are we able to just do that and get that ball rolling? I mean, it's not county board.
This is more kind of a task force oriented with
Right.
outside.
And I guess I'm wondering too, since Partners for Prevention has been in place for 3 years, we're in the 4th year of its founding, and it was based on some previous actions. Wonder whether someone from Partners for Prevention could be also possibly considered for the committee.
Madam Chair, I think many of these entities are not under county control, so I don't, I mean, we could recommend that the county participate, but, you know, Richland Center Police Department and some of the others, it's just, we've got to ask.
Mhm.
How we structure probably depends on how you're most comfortable in having a recommendation brought forward to this body. If you want it brought through an administrative type of a means, then I would say working with Director Clemens to establish a task force where that's an advisory group to her in conjunction with us to bring a recommendation to you folks. If you want another subcommittee advisory type to respond directly to yourselves, then that would be more formalized of either by resolution or some means to formalize an actual committee to assemble.
No, I'm happy to have you set this task force. So, and then I don't know, I guess that would be a determination on your part, what other entities such as Partners for Prevention you'd want to include in that. Yeah. Okay.
Yeah, and I wouldn't be objecting to having Partners for Prevention be a part of that.
Yeah, I think that would be great. Okay, so then if there aren't further questions from our committee or anyone else online, by the way, I don't mean to stop anyone.
Madam Chair,
Yes, Mr. C.
Would this task force be acting as a government body?
Advisory.
I don't believe so. They're just advisory, bringing forth a proposal.
Don't see any type of authority that they're going to exercise. It's community stakeholders that are going to be advising essentially through the director and myself on where they think the funds could best be appropriated or existing challenges or ideas that they have.
The final authority and decision-making would be with the Health and Human Services Committee?
I think I would see this as this body proposing a policy on the use of the funds and what the plan looks like as a recommended resolution to the county board to bless off on. And like we've established with other policies, then potentially though giving discretion and authority to this body to make amendments to that policy once established.
So ultimately, the county board would be the authorizing authority.
Correct.
Is that correct, Mr. Langberg?
To how we have it established with setting policy correct, because we don't have any other existing resolution out there that already kind of defers that responsibility. So I would say the initial resolution to establish a policy and plan on what you would want to do would be recommended to take it through the county board. But then again, at the discretion of how you folks want to put the policy to approve it, recommend it, like we've done with other policies, once established by the county board, they can thereby delegate authorities back to the Health and Human Services Board to make decisions on appropriations and what that looks like, and potentially have authorities to amend that policy as well. Does that make sense, Supervisor C?
Yes, it does. I think the county board should be, fully aware of the program.
So what I'm seeing, or what I think I'm hearing, is that right now we really can't act on this resolution, but we want the director to go out and do outreach and come back with who's going to join on board, and then we would do an official resolution. Is that a good game plan?
That's where I see where we're at. We've
Correct.
contracted with Southwest Partners. They've helped us identify where we think our priorities are. So now it's partnering. It's using that information to establish what we want to prioritize and how we're going to apportion those types of funds, and kind of using this advisory task force as the sounding board for that. It's brought back to you folks as a policy draft for your consideration, approved by county board, and then adjustments to that then potentially are made by this body.
So yeah, I don't think we would have to do this officially, but since we have this prepared before us, we can put our stamp of approval on this recommendation essentially to create a task force. So would somebody like to make that motion?
I would.
Okay, Mr. Van Landijk, do we have a second?
I will second.
Okay, Ms. Chicker, any further discussion? All
I
right,
think this is an excellent thing if you were to start looking into this and maybe setting this up so that the entire community is part of this. I think it's an excellent idea.
thank you. Okay, all those in favor, please say aye. Aye.
Aye.
Any opposed? All right, recommendation carries. Thank you, Misty, and thank you, Director Clements, for preparing all of that. Okay, number 18 is a resolution to recommend to County Board recognizing the retirement of Ms. Rose Cahoot, Public Health Manager and Local Health Officer. I brought this forward. I worked with Angie on some of the details here. So you can see in the background it lists Ms. Cahoot's employment history with the county. And so this would be just a recommendation to send this on to County Board to be approved. Would you guys like me to read the actual resolution language? Had it in your packet. Okay, if not, any questions or discussion? All right, then I would need a motion to send this forward to County Board. Thank you, Mr. Renish. In a second?
Second.
All right. So I have a motion and a second. Any other discussion? All right, this is just we really appreciate Ms. Cahoot and all of her work, especially during, we wanted to especially recognize her work during the COVID-19 pandemic. So I did include that language in there. And I plan on letting her know that this will be going to County Board. So if she would like to come to that, she can. So all those in favor, please say aye.
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 Any opposed? Hey, thank you. Takes us to our admin report for Director Clements.
So we'll start out with the appointment of Brandy Anderson as the interim public health officer and manager for that unit. With Rose leaving, we do have to have somebody in place, and so Brandy has been appointed as the interim manager. She has jumped in with both feet, and so far things are going well. Previously, the nutrition program was with the public health unit, and we had made long-range plans to have the senior nutrition program transition to the ADRC in 2024. With Rose leaving, I have taken the nutrition program under my supervision at this point in time because I did supervise it in Vernon County until Roxanne with the ADRC can get up to speed with program rules, expectations. We do have a meeting on Friday with Guar, who oversees the program, to bring Roxanne up to speed about the program, the expectations, the rules, and the system that is used to document all of the nutrition program. So we are working on that, and the hope is that by May, she will be fully supervising the nutrition program. With our economic support unit, they are in the planning stages for the unwinding that will begin soon. So with the public health emergency ending, while it was in effect, everyone's Medicaid continued and no one was having to do their yearly renewals for Medicaid. That will begin in July. And so the consortium managers and supervisors have been meeting regularly and planning ways to make this transition as smooth as possible. It really will take a consortium-wide effort to provide the best customer service. The Capital Consortium is expecting that about 100,000 members will have to have their Medicaid renewed in a 12-month time period. So they will be extremely busy during that time. In mid-March, healthcare members will start to receive mailings regarding when their renewal dates will be. So it will be divided up over the 12 months. Right now, there's no date set for the return of the food share work requirement policy. As of right now, there are no work requirements to receive food share benefits, but that is something that will change in the future. Economic Support Unit does have 2 new workers, and they are on the call center full-time and taking all sorts of calls. They are fast learners and doing a great job. Our Public Health Unit updates. Brandy Anderson is currently working on updating the COVID vaccine and vaccine for children forms and contracts required for continued handling of these specific vaccines. Federal funds supply our vaccine for children vaccines that we keep on hand. The process for updating these include updated training prior to submission of these forms. With the transition, Brandy has also contacted the Wisconsin DHS COVID vaccine program and was authorized to continue to offer appointments on Wednesdays from 1 to 4:30 for COVID vaccines. Public Health encourages all other appointments for vaccines to be scheduled by appointment versus as walk-ins, as they only have 2 staff nurses on site right now. COVID antigen test kits are still available and will be reordered. These are distributed to the public from our main front desk. Brandy has connected with the Southern Region Director with the Wisconsin DHS Office of Policy and Practice Alignment to coordinate an on-site visit to the Richland County Public Health Department. This visit will occur on Friday with Brandy to assess what our current needs are, provide support and guidance to her, and offer suggestions, all because of our previous health officer's departure. Brandy has also scheduled meetings with another health officer in the area, Amy Kleiber from Vernon County, to address some workflow issues, provide some guidance that would be a benefit to the unit with the decreased staff. And they have had phone conversations and email and are planning a meeting in the near future. COVID community transmission in our area remains low per the CDC as of the 8th. Public Health is currently mentoring a BSN student from UW Green Bay for her public health clinical on Mondays in February, and they will continue to work with her until her hours are met. Our ADRC update: the transportation program will be holding a public meeting at the Phoenix Center on April 18th from 11:30 to 1 to gain input from the community regarding transportation in the county. This information will be used to prepare the program's 2024 to 2028 transportation plan. The ADRC's Dementia Care Specialist Program is currently hosting Boost Your Brain and Memory at the Brewer Library. This program is an 8-week evidence-based program that takes a holistic approach to improving brain health. There are 11 individuals who are taking the course. The ADRC will also be offering the free showing of Anthony Hopkins' movie, The Father. This showing will be on February 18th at 7 p.m. and February 19th at 1 p.m. at the Center Theater. ADR staff are also preparing for the unwinding of the public health emergency. This means that they will return to pre-pandemic requirements for providing services, which includes no longer having flexibilities to do many tasks over the phone or via Zoom. Along with this, staff are preparing for increased referrals to the ADRC for individuals who may be disenrolled from long-term support programs due to a loss of Medicaid benefits. In our behavioral health unit, they have been having some discussions with the jail on a MAT grant. This is something that they are exploring to see if it would be a benefit to the community. There has been some movement in the unit. Kelly McCann, who has been the psychiatric nurse for the clinic, has given her notice, and her last day will be on the 16th. Alice Lawrence Rentrum will take Kelly's place in the clinic, and Mackenzie Fisher will be the interim crisis worker. Beth Muth is currently and continuing to train as the mental health case manager. With the Children and Youth Services Unit, they are in the process of hiring a full-time family preservation worker to assist with family interactions, parenting and outreach for prevention service with families. This position was part-time, but recently vacated at the end of January. One of the changes that we are making in that unit is there was a full-time social work position that has been vacant, and the family preservation worker, both of those positions were in the unit. We have opted to have a full-time family preservation worker and no longer pursue the filling of that social work position. Through discussions with Jessica and Brittany, we felt this was the best utilization of the resources. Jessica is back from maternity leave, so we are happy to have her back after her 3-month stay at home. Hannah Udelhoven recently participated in forensic interview training. This is an intensive 5-day training related to interviewing victims of abuse and neglect, and there remains 1 staff member left to go through this training. They are also working with the courts and the Amy Forehand to attend a coordinated conference later this year. It's the Conference on Child Welfare in the Courts. We are also working to update our MOUs and policies with community and professional partners in the upcoming months. And the focus areas in 2023 for that unit will be permanency and safety and protective planning for the families that they work with.
Thank you. Does anyone have any questions? All right, so I see you have listed HHS future budget response.
So that was on there per Tim's request, and we can make that till next month if needed.
Well, I think he's on.
Okay.
So Tim, Mr. Gatchell, when Ms. Knock was still here, I apologize. I could not remember what your specific request was for the agenda item that says VSO future budget response. But then when I see it again here on HHS, I'm assuming, do you mean the response to the 5-year plan, proposed plan?
Yes, that was my intention when I
Okay.
mentioned it last month. And I think that plan, now that it's been adopted through full county board, I don't necessarily have anything to discuss today or that I wanted to discuss today unless someone else does.
Okay, so you don't have questions related to that specifically then?
Not at this time, no.
Okay, then I guess we will remove those from the agenda. All right, thank you. So let's just do the personnel updates and then we'll go back to that number 7.
Okay, there it is. So personnel updates. So we had, as mentioned previously, Brandy Anderson is the new interim public health manager, local health officer. That started on the 23rd, as well as Mackenzie Fisher had been transitioned from a mental health therapist to a case manager. We will probably be transferring her back to a mental health therapist soon. So that'll be another internal transfer. But Kaya Holtzman passed probation, Child and Youth Services case manager. So that was really exciting for her. She did that February 15th. And then, of course, we had the resignations that we talked about a little bit. Kelly McGann, psych nurse, will be done on February 16th. And Cecilia Christensen, family pres worker for the Child and Youth Services unit, resigned January 31st. There's a few positions listed that we're currently advertising for. That's the CCS supervisor. And of course, Rose's position, public health manager and local health officer. We're still actively advertising for those. And then we have 3 that are relatively new, that are vacant, that are on hold. And then, of course, the gray highlights have been permanently kind of on hold. And then Trish and I had talked about having a placeholder for that reduction of 5 positions per the resolution 2296 for 2023 to 2027, needing to reduce 5 health and human services positions. So we're at 3 right now. But just so we have a space holder so people don't forget as we have so much movement.
So, and maybe you already mentioned this, with the resignation of Kelly McCann, then we are not filling that position? Is that the one that's listed down below?
No, what we had when I started was Kelly was the clinic nurse, but she was also doing APS work. Okay. And so we had Sherry McGowan that was leased through us that was also providing support to the clinic. And with Kelly being able to be full-time in the clinic, as we have hired Cindy Bromlin to be our full-time APS worker, we no longer have the need for Sherry McGowan. So that's our public health nurse. Or no, I'm sorry, not public health nurse, behavioral health RN, psych RN, the psych RN. So
That's the one that's
the one that's on there.
okay.
So it was a leased position that worked about 15 to 20 hours a week.
Okay.
And with filling other positions in that unit, that's no longer needed to support that person.
All right. I think I understand.
Okay.
Thank you. Anybody else have questions? No. All right. So we'll go back to number 7. So the reason why I had put this on there, review of committee purpose and committee structure tasks. I think I mentioned this a little bit last time. You know, we've had just over the last few years. So I started on the board in 2017 as a citizen member. And when we moved to administrator form of government, a lot of the way that our meetings and the things that we needed to do has kind of changed. And that didn't all happen at once. I know Tracy Thorson, when she was director, had really kind of looked through that and how that was changed. And we've made some more changes since then too. And so I just kind of wanted us as a committee to look back again at like, what is our purpose and how can we best function in that purpose and support health and human services and support our county. So that's why I kind of wanted to look at it. There's actually a lot that goes into that. So I did not include all of the things that our board structure references, but if you look at number 7, committee purpose and structure documents, so not the first one, but the second number 7, and you scroll down to page 11 of the 22, we have our standing committee, the description from our Richland County board, the description for Health and Human Services and Veteran Standing Committee is highlighted there. So right now I'm more looking at the Health and Human Services board portion of that, not the veterans portion. So if you look at letter D, acts as the Health and Human Services Board as follows. It lists in A, the makeup of the board, and then B, to provide oversight and advice, i.e. policy making, determining the broad outlines and principles governing administration regarding a program for the providing of services to the mentally ill, developmentally disabled, and alcohol or other drug-dependent citizens of Richland County in accordance with section 51.42 and 51.437 Wisconsin statutes. I didn't include those in they're pretty lengthy, and I'm not entirely sure as I was reading through those what portion is for us specifically and what was for, I think it's for Health and Human Services, but it just kind of gives overview. Anyways, I'm gonna look at that a little bit more. C says perform the duties set forth in Chapter 251 Wisconsin statutes and such other duties as may be imposed upon it by the county board. Veteran citizens appointees will not act on decisions brought to the Board of Health. So Chapter 251, which you do have in your packet, that's the other number 7, that's specifically concerning the local Board of Health. And again, it's highlighted in there. It also makes some exception if you have a county administrator form of government, and we can look at that in a minute. D, exercise those powers and perform duties set forth in section 46.22. Again, I didn't list that one. E just states we have to go to county board for approval of any contracts that are $30,000 or more, I believe is what that statement is. And then again, so F and G are just providing oversight and advice. So again, that policy making, it's of the building, the parking lot. In G, it's talking about county liaison for senior citizens funding and other elderly services. So there's a lot to kind of comb through. I will admit my strength is not digging through legal language. I know Carrie is very talented at that. Carrie, are you still online? And I also believe that Tracy, which I need to go back and look at that, had prepared some sort of document where she kind of discussed what she felt like our background was. But I wanted to put this forward to you guys. When we look at this, and we don't need to do so much action, you know, when I used to sit on the board prior to administrator, we had to do a lot of approving of budgetary things, and other items similar to that. And we don't need to do that so much. And, you know, when it says policy making or oversight and, let me look at that again, oversight and advice, you know, what does that practically mean? I don't think that means that we need to sit here every meeting and make a new policy. That wouldn't be an effective use of our time. So I actually had called Director Clements and kind of asked her too, what do you think, how do you see our board functioning in a way that can be really supportive of you? And I know she did some research and kind of came up with some of her priorities. You want to share those with us?
So the three that I really came up with that I felt would be beneficial to the department is really guiding us and giving us some support on prioritizing programs. So if there are new initiatives that we're looking to, for us to be able to bring them to you to talk through it and determine, is that our priority? Is that what we should be working on as a committee, as a department? One is advocacy. So if there are programs, services, goals, ideas that we have to support us when it goes to the full county board, and then also support us in the community in regards to our programs. One of the things in regards to that Ingrid and I talked about quite a bit is making sure you guys have a full understanding of what these programs are. And that's why we had Brandy come to talk about treatment court. She's the one who lives and breathes that program every day. And for her to be able to come and explain to you what the goals are, what the purpose of that program is, who we're serving. And so we're really hoping to do more of that in the future. And then to have just discussions on goals for our department. One of the things Ingrid and I talked about, and one of the things that we're going to be working on this year, is with Rose leaving, what does our public health unit look like? What do we want to prioritize? We're in a phase now where we're unwinding from the public health emergency. That's ending. Our focus has been so much on COVID, and what do we want that unit to focus on? And that's information I would like your guys' support when we make those decisions. You know, we will have the community needs assessment that will guide some of that, but I do want to make sure that the committee's full well aware of what is it that the community wants, what are the things that we can offer, and where do we go from here? And we'll come with recommendations, but really do want your input in regards to that.
Thank you. So I really did want to actually just have this be kind of a discussion portion. I'd like to hear thoughts from you as committee members. I don't know if you had a chance to kind of review this or had any thoughts on this. Some of you have history of being on the board, others of you are newer, but please share any thoughts you have.
I see us as kind of your liaison to the county board. I think you guys are the experts because you deal with this every day. We're here once a month to hear what you've accomplished and what you would like to do. And I think we are here totally to support you and to recommend things to the board. We're kind of the in-between. So I see our position as being twofold. It's to listen to you and maybe to add our voice to what you may have and to support what it is that you're doing, and then to take our ideas to the board to get approval from them to continue what it is that you've expressed that you need. So I see this as a good relationship, and I like it kind of the way it is. So thank you.
I like to me, the priority in life and anything is goals, because if you don't have a goal, you're not working towards anything. So you set and establish a goal. And coming out of COVID, yes, I liked the treatment court. I think that's the future, because our number one priority here is working for our constituents, is to watch their money. And, you know, the 1-to-11 ratio she talked about, by being proactive with the treatment courts and the opioids, and it's ultimately, you're doing the right thing, but ultimately it's going to save the county money. So I believe you need to establish, you know, every year as this board committee gets together, establish some goals. And then that gives you, you know, you're automatically going down a path, you're collaborative, and everybody's working for the same thing.
Thank you. I appreciate that. Mr. Brathwaite?
Well, one of the things that I thought about is anything that we can do for prevention. And I think that kind of reinforces what you were saying. But in any of our programming, if we can prevent, it's a lot easier and less costly than trying to remediate. If that's it for right now.
Thank you. I'm going to go through those of you that are online. So let's see. Looks like I can see Mr. Gotchel listed first up there.
I don't think I have any comments or questions.
I know that you have a bit of more history with Health and Human Services, so probably a broader understanding. I guess I don't want to put you on the spot, but how do you see our board functioning best?
Yeah, I think I concur with some of the comments that have been made earlier in this conversation. You know, in the past, we functioned, I think the board functioned as more of that administrator oversight prior to Clint coming on. So I think moving kind of away from that day to day, you know, which we have been doing over the last couple of years, but I think more broad sweeping, as Mr. Renish was saying, broad sweeping initiatives. You know, I like to be able to speak with my constituents, like this is what Health and Human Services is doing, or any of the various committees that I sit on. You know, I can kind of rattle off the elevator pitch, if you will, and I think you know, to the extent where we can offer guidance and insight towards some of those higher level goals, I think that's where I'd really like to see the committee go.
Thank you. I appreciate that. Mr. Steve.
Yes, I was thrown off by the elevator pitch. I don't know what that is. But good. You'll have to explain it to me later. Collaboration is such an important element of our work in human services, I believe. And Mr. County Board Member, Mr. Renish, mentioned the word collaboration with emphasis as well. And we have so many resources that we can be to one another, and the business of being resourceful to one another is so important. I think in particular, and we're not talking about the veterans thing here, but I would like to see more collaboration on the part of Human Services and the Veterans Services Office. After all, the Veterans Services work is basically human services work, and I do not want it to continue to be in its silo, so to speak. So I'm hoping that we can encourage more integration of that function with human services, and I also believe that, well, we're not talking anymore about structure and function with respect to veterans yet, and I don't know whether you want to touch on that, but I'll leave it at that.
Thank you. I think that's worthy insight, Mr. Seep. Ms. Chicker.
I did have an opportunity to review the materials, and I just really agree with what everyone has said so far, especially Mr. Renish about the goals. I'm a little bit fuzzy on the picture just painted of veteran services acting in a silo. I believe it's pretty much the same as the different departments within HHS. It's a new addition to the assignments of this group, perhaps, and maybe we're all still getting used to it. But that was really about it. I don't have anything to add.
Thank you, Ms. Chicker. Who's next? Harry. Mr. Severson.
Hi. It would take a little bit of time for me to like digest, but I just don't want us to get away from that we are still beholden to the taxpayer, and some of us were elected to be in this role and to be pretty fiscally responsible with that budget and to make sure that we're going down the right road. So I do agree that we could be focused on some stuff, but the other half of this is that we're kind of beholden to the taxpayer and to the county board with some responsibilities in providing some oversight. If we wanted to have like a separate coalition to do different things or a different group to do that, that's fine, but we still have a responsibility. So I think a lot of this is good, but I just don't want us to get away from our role.
Thank you, Mr. Severson. Is Ms. Ruderstorff still in? Ms. Ruderstorff?
Yeah, I kind of agree both with Mr. Severson and Mr. Gotchel as far as yeah, as far as the main like oversight, I think is kind of, but also as a collaboration, I like that word as well. I think we are more we get most of the information here, but so we kind of get the bigger insight and input on things. But like Carrie said, we do have the fiscal responsibility to our constituents. So I guess I don't really have anything to add.
Okay, thank you. Dr. Barris?
Yeah, hi. I guess my idea of this board and boards in general is that of a more of a macro type management and general oversight and direction. Like the boards, like when we were on the board before, I don't think we need to look at every penny that's being spent and vote and approve, but we do have the information. We do have a responsibility for general oversight of that, and I think we are responsible for that, but again, it should be more on a general basis and let the people that we have that are excellent and well-trained handle the day-to-day operations and just provide the general direction that we want them to go.
I do appreciate Dr. Barris's comments. He probably said what I was trying to go get after a lot better than what way I could.
Thank you.
I was doing the same thing, Carrie.
Is Ms. Hillishine still on the line? Sherry?
Yes.
Hi. Did you have anything to add or comment?
No, I've just been patiently listening, but thank you for asking.
Thank you for being patient.
Madam Chair.
Yes, Mr. Seep.
May I add, just a matter of emphasis, that it is the responsibility of each of these the programs are functions of county government, and it is responsibility, the duty and responsibility of county government to provide adequate oversight. It does not mean micromanagement, but it means that we have clear policies and procedures for the functioning and delivery of those services. So we should not overlook the duty and the responsibility of the county government function to have oversight.
Thank you. So as I'm looking over my notes here, and I can kind of digest this more later, but looks like we kind of are mostly on the same page as far as the oversight, collaboration, general direction provision. And just to address, I think it was Carrie mentioning some concerns with budget oversight. I just want to say this does not mean that we will not still be being a part of the budget process during, especially setting for the next year. That's going to continue. I think the focus just being not so much on, I can't remember which one of you said this well, maybe Mr. Gotchall, of not so much the day-to-day admin type of duties that are not really necessary for us to be doing at this point. So I just wanted to make sure with you guys, and I would appreciate and invite you guys to continue to give feedback as we have kind of changed the way that the agenda lays and what we've included on there. So please give me input if you see things that you want changed, or if you feel like in order to meet these goals, and maybe I can get them kind of summarized better for us for next time, but of providing that general oversight and setting goals and collaborating. If you can see ways that we could better do that, then please, give some input or suggestions. I know Trisha and I did talk a little bit about what if with her 3 kind of goals, which I think fall right in line with those, prioritizing programs, advocacy, discussion of goals. What can that look like then for our future meetings? And I believe you were going to come with maybe kind of a more description of what your goals for this year, this coming year would be, and allow our input on that.
Yeah, and we talked about, maybe next month having the public health unit as a whole on there to discuss what do we see for the future for that unit, bringing in the community needs assessments and recommendations related to that. And so having some of those focus areas on the agenda.
Yes, and I know, Mr. Severson, you had mentioned you wanting to hear more about the community health needs. Ms. Cahoot did give a little bit of update last month, but we're hoping to have more on kind of timeline next month. I do know that I'm sure that opioid and drug issues will be one of the top ones. And so I do think that it was timely that we had this report this month, that we have a couple of things related to that on our agenda, the TAD grant and then this opioid settlement. I believe those are definitely going to continue to be a focus for this board and our department. Anyways, I appreciate all of your input. Is there any other discussion or comments on that? Otherwise, we're going to try to be kind of hitting those priorities in some form on our agendas and moving to that broader picture. Okay, so that takes us, I guess that segues nicely into future agenda items. I won't go around this time, but you can always contact me with those. Does anybody right now, can they think of anything that they would want on a future agenda?
Yes, Madam Chair.
Mr. Seep?
There was discussion in the last meeting about the governor making $14,000 available to potentially to the Veteran Service Office through a grant process. And I would like a report on how that is proposed to be used in conjunction with the committee's interest in applying for the grant and approving an application for the grant. So I would like to know, what the Veteran Service Office is proposing to use that money for, what programs or so forth.
Was there a specific name to the grant? Does anyone remember? Mr. Langrick?
I think it was CVSO supplemental grant. I'm not sure if it was more extensive than that.
Okay, so maybe just update on the CVSO supplemental grant and its proposed use. Is that what you're asking, Mr. Seep?
Yes, I'm asking to answer the question, what do you propose to do with that money if you get the grant?
Okay. All right, thank you. I'll I'll discuss with Ms. Knock on that, and we'll look at potentially putting that on the agenda. Thank you, Mr. Seep. Anyone else?
Yes, just a reminder, we need to put the Teddy Roof Fund on that, and I'd like to see that put to bed, as you had said.
Yes.
And maybe that should come up and we can kind of do away with that and let it sunset so that we don't have that there. It's been kind of floating in space for a lot of years, and we need to use it and be done with it.
Yes, I believe that's the plan. We'll have that on our next agenda. We have that policy in there, so you guys just review that and then we'll discuss that next time.
Correct. Thank you.
Yes, thank you. Right, anyone else? All right, if not, thank you all for coming. And thank you to all of the department staff that contributed. I know it's a lot of work every time and I appreciate your time. I would take a motion for adjournment.
Motion to adjourn.
Our next meeting, thank you, Mr. Renish, will be, oh gosh, what month is it? March 9th at 9:30. Thank you, Mr. Van Landite. All those in favor, please say aye.
Aye.
Aye. Thank you
Have a
for,
good day, everyone.
thank you
Happy
for a good
birthday,
meeting.
Ken. I want to wish Ken Renish a happy birthday.
Oh,
Oh, old man.
same.